everyone. Thank you for tuning in. My name is Ashley, for those of you that don't know me, and I like to help teach women how to gain financial freedom as well as teach people about thyroid illnesses and their health and wellness. So today, if you've missed the other videos, make sure you hop on over. My link tree is in the bio above, and you can join my Facebook community about thyroid health, and you can catch all the other lives because they're in sync. So if you missed a couple, this might not make sense, so you may want to go back. So today we're going to talk about the stages of EBV. And there's 4 different stages, and thyroid illness develops in the 3rd stage, right? So there's stage 1, and that is the baby stage. You could be born with, or you could have caught this, and it's dormant in your bloodstream, and it just happened to come about at a certain time due to one of the triggers that we discussed in prior videos. Your symptoms can be mild, they can be minimal, or they can be more forceful in the baby stage. It's quietly replicating in your blood, waiting for the right conditions to come out, right? And when the conditions are right, it goes to stage 2, the mononucleosis, where it infects your liver and your spleen, and then you start to feel it more so, right? So in stage 2, that's going to be the war stage, is what they call it, and that's mono. And mainly it's prevalent in college, partying. People are studying, they're partying, they have this poor diet, they're not taking care of themselves, and 70% of college students get mono within their 4 years that they're in school, right? And you know, younger and older can develop it though, but it's children can get it or have it, but it's against the rules for doctors to diagnose children under the age of 6 with this illness, right? And this is really what's hindering the progress of the diagnosis and things like that of EBV and the studies on it. In babies or kids, they seem to call it rheumatic fever or glandular fever, if your children have ever gotten that diagnosis. And this is the infectious phase, and your body is at war with the EBV, right? And the EBV's goal is to take down your lymphatic system, and this is when you have the mono symptoms, right? You know, it can last for a week or a few months, and then it can go dormant in the liver where it feeds on toxins, because almost everything that you consume goes through your liver, right? And the blood tests don't show this. It just shows it as a past infection, not realizing that this has just gone deeper into your body, and it's like going in for a stronger battle per se, right? And so when the EBV rests in your liver, it can cause your A1C levels to go up. It can cause type 2 diabetes. It's been known to cause high cholesterol, hepatitis A, B, C, and D, fibrosis, liver inflammation, new food sensitivities, a low hydrochloric acid in your stomach causing bloating, constipation, different allergies to foods. It can sometimes be diagnosed as a leaky gut as well. So if you've ever noticed any of those things, or if you've ever noticed your diagnosis from the doctor with these, be woke and do your own study. Like, you don't have to believe what I believe. This is just me sharing my knowledge to open your eyes. You know, you can study and, you know, make your own decisions, right? But this is all studies that I discuss and talk about, right? So some, it won't stay in the liver, right? Others, it'll move to your spleen. It'll move to your reproductive organs, which is causing infertility. In your spleen, it causes enlarged spleen. In women, it'll cause fibroids, PCOS. But in men, it'll target the prostate, which leads to cancer, which can lead to cancer, should I say. And stage 2 can last 1 month to 20 years, and it just depends on you. It depends on your living conditions. It depends on the triggers that you come in contact with. Like I said, if you've watched the other video about triggers, you'll know those triggers that you need to be aware of. So then you're going to go and transition onto stage 3, which is the thyroid stage. You know, some will experience mild monosymptoms. This is when your liver is filling with toxins and it's released into the lymphatic system, your bloodstream. And over time, this wears down your immune system, right? And the lymphocytes leave and the EBV attacks and get into your thyroid gland, right? The monosymptoms will fade, and then the thyroid issues appear, often mistaken for just getting older, having menopause, or an autoimmune issue. But thyroid cells are then killed off, and the dead casings are what enter the bloodstream, right? And then tests recognize this as the Borrelia bacteria, and often it's misdiagnosed as Lyme disease in people, right? So triggers previously mentioned and the American diet, they're all going to fuel this virus to just attack your body even more so. So you see hypothyroidism, you're diagnosed to deal with it. It's the EBV that's the problem. And over time, if EBV gets more aggressive, it creates inflammation, which is thyroiditis. Thyroiditis is just a term for inflammation, right? Causing enlarged thyroid. In the inflammation phase, your body creates antibodies to go after the EBV. That's a good thing. Like, you think that your body is fighting against you, but it's actually trying to fight off the EBV, right? And doctors say mistakenly that this is your immune system destroying the thyroid, but this is false. These antibodies are proof that it's fighting the EBV, right? Your body, when you get, they preach when you get vaccines and things like that, you know, it helps your body fight. You know, when you get a virus, your body creates antibodies to fight off whatever virus is trying to get, right? And as hypothyroidism advances, it becomes Hashimoto's, not the other way around. Many think Hashimoto's causes hypothyroidism, but it's not true. And childbirth, like for me, triggered this to come about, right? So in stage 3, you may experience some fatigue, some brain fog, some heart flutters, bloating, confusion, hot flashes, anxiety, issues with your sleep. You may have aches and pains, chronic sore throat, fever, numbness, tingling in certain areas of your body, thinning hair, brittle nails, you know, the typical dry skin, even some dizziness, things like that are all part of stage 3. And if the virus is in your thyroid, you may develop small lumps, right? And these small lumps are called calcium prisons. And these are created as a wall or a barrier to try to protect itself. So if they stay there, they can turn into cysts, they can grow to benign tumors. With rare aggressive cases of EBV, which is like stages 4 and 5, that's when cancerous tumors can develop. And this means that there's a high toxin level in your body. And the virus's job is to weaken your immune system, right? And this is what shifts your adrenals into overdrive. And this is what is fuel for its growth, for EBV's growth. Adrenal plus cortisol will cause EBV to grow, right? It wants to get in your central nervous system. And this can be stopped or reversed or even controlled, though. So you must be an advocate for yourself and take control. And you have to do your own study. You have to get your own education. And I really like just, you know, putting this information out, putting it into groups, because I feel like there's so many people that are being diagnosed with thyroid issues and they just take the medicine and go about their day, but they still experience all these symptoms and they don't know why. And this is not a way to live. I know for the longest time, like I tell my husband, I'm like, I just want to feel normal. I want to feel like a normal human being, how I did before I had this thyroid issue. So I hope this gave you some value. I hope that, this helped you in somewhat. So, I could go on to stage 4, but I'm going to save that because that's a little more in depth. And then we'll go into the link, the autoimmune link, and maybe a few more topics, just depending on the time. So I hope you got some value from this. If you did, click the share button, drop some love below. If you have any questions, make sure that you drop them below as well. I'll be happy to answer any questions that I can. Remember, I'm not a doctor. I am just someone who definitely likes to study and figure out and what is going on inside of my body personally and share my knowledge. So I hope you all have a great day and talk to you soon.